audience on the topic mental health and pandemic. Can we give a huge round of applause and welcome Dr. Praveen Kumar, Chintapanti.
It's such a pleasure to be here, and it's very difficult to carry the mantle from Dr. Shrikant. I think, Sarve Bhavantu Sukhina. So, yeah, with the same spirit of Sarve Bhavantu Sukhina, Sarve Santu Niramaya, Sarve Bhadrani Pashyantu Ma Kaschit Dukhabhag Bhavet. The Niramaya, the absence of disease, I think is an essential core of Indian existence and Indian thought and Indian mood. And it's been the core of Indian innovation as well. I, at the outset, would like to thank Dr. Buri Rangareddy Garu for offering this opportunity, and I'm extremely grateful. And it is a very efficient team of John and Harshita who've been there throughout, guiding me right from the way till the venue. Thank you very much indeed. It is a difficult session most of the time when people have this psychiatry session happening. The first thing you'd see is that the number starts dwindling out. I see lots of people who are enthusiastic and young innovators being here. And today, I promise you that I will not let you go empty-handed, and this is not going to be a shell, airy-fairy, how I may talk. So you're going to enjoy it. At the same time, I ensure that you have something to take home as well. We have constantly, whenever people spoke of, psychiatry, mental health, there has always been the thing pagal nahi to theek hai. This fellow, psychiatry, psychology, mental health, the first thing is that people are aggressive, they go throw stones at people, they tear their clothes apart, or they hear voices. That's been the core understanding of psychiatry. And now, ladies and gentlemen, things are shifting, the waters are shifting. And the whole idea of, psychiatry bole to छिपा के रखना हमेशा होता है कि घर में कोई somebody needs mental health help, and somebody has a fractured arm, we always get uncle to sign it, aunt to sign it. Fracture पे पट्टी पे हर कोई sign करता है. The people would come in and say, love you, her. And when it comes to psychiatry, when people are hurting a lot in the heads, people have this idea of hiding them in the room. छिपा के रखो. And simple things like anxiety. I am afraid, I'm anxious, I get worried about little things. It could be exams, it could be getting married or going to the job interview. And the first thing you want to tell is that, मुझे घबराहट होती है, I'm really afraid to go and see somebody out there, for the first time. I want to see this interview person. I'm really afraid I might really not do well. Or I might think I think I'm not a great interviewee, and people might really underestimate my abilities, and people might think that I'm a stupid person. So where will I go and talk to? Who will I go in to talk to? No, छुपा के रखना है, क्योंकि this is vulnerability, this is weakness. Mental health has always been equated with weakness. Mental health has always been equated with frailty. Mental health has always been equated with fragility. अरे आजकल तो बड़ी शौक से बोल लेते हैं people, old people going for walks in the morning, or young people, they'll say, अरे मुझे डायबिटीज है, मैं 4 दवाइयों पे हूँ, I'm taking this XYZ, and I take my insulin myself. Very proud. And when it comes to anxiety in elderly, we don't want to talk about it. When people feel sad, when people get depressed, because this is not something which is out there in another planet on Mars, which has to be explored by a Mars rover. It's there amongst us. 7 amongst 100 people will get depressed. That's out there. And 1 in 4 people will develop some sort of mental health problems at some point in their life. That's like we have 100 people here, like 25 of us will have some anxiety, depression, or major illness at some point of time. So we are not immune. There is no vaccine, Covishield for mental health issues at the moment. So we are all likely to experience, or a loved one is likely to experience. And I am sure we all know somebody who has tried to kill themselves, and we all know somebody who has, completed a suicide, or something else has happened. We all know somebody who drinks to excess of alcohol. We know these are all nice people, and we all know people who do lots of drugs for no obvious reasons. We all know. I would challenge, if there is a single person who doesn't know somebody within their friends or family, or even their own problems, that they're not touched by mental health issues. I can tell lots of people who are not touched by cancer. There are lots of families who might have not seen cancer in their lifetimes, but they would have seen mental health issues. And this is something which is thrown quite behind. And the biggest problem, because it's the Cinderella, like, the story of Cinderella. Where is Cinderella kept? Down in the attic in cinders. Cinders is where the fireplace is, and you have all these smoky cinders out there, and she gets dark because of the cinders, and she's hidden. So psychiatry becomes the Cinderella of medicine, and she's hidden till she meets the prince. So this is the time. I really appreciate Dr. Rangareddy Garu to have psychiatry at the innovations segment. I think this is an extraordinary time, and I'm really grateful. The Cinderella is meeting the prince, and Cinderella is meeting the innovators. Ladies and gentlemen, psychiatry is one specialty. As innovators, I beg you and I urge you and I tell you, this is an extraordinary opportunity. If you are an innovator, you are likely to do more than anything and anybody in terms of humanity by innovating in the space of psychiatry, because this is a virgin canvas. And this canvas is so beautiful. Everything and anything you do is going to affect everybody and any person on the planet. So this is a virgin canvas for all the innovators to paint their picture. And there is a need, not just innovation in terms of technology. People always say, psychiatry mein kya mil sakta hai? I mean, I innovate and I research on drug molecules, I research on therapy, talking therapies or whatever. But as the technology has advanced, this pandemic, we know that pandemic has impacted lots of people, and pandemic has caused quite a lot of, what would be considered as emotional distress. And the biggest thing is the uncertainty the pandemic has driven into our lives. The worry that, kya hota hai, kab khatam hoga, lockdown kab khatam hoga, hum kab bahar ja sakte, when will I get back to my job, will I lose my job, will my children be able to go to school, will my children be the less benefited generation of the whole lot, 20 years from now, will they be able to compete with the people who are before the pandemic and after the pandemic? This is and has been an age of uncertainty, which has driven tons and tons of anxiety amongst people. So we know that pre-pandemic and post-pandemic, especially in lots of countries, especially European and American, both South and North Americas, you find that there is an increase in anxiety, increase in depression. Surprisingly, we did have an increased, what would be considered as service consumption during the pandemic period within psychiatry in India as well. But there's something beautiful which has happened. We have been consistently blaming, moaning, consistently, very, unpleasantly, we have been telling ourselves and portraying ourselves as victims of this huge pandemic. I know nobody wants a pandemic. I would not want a pandemic. But I'd like to talk about the human resilience and the positivity which pandemic has brought out in humanity, which wasn't seen in the whole of the generations, like I'm talking about the post-independence India, and probably we might not see that even in the next probably few generations, a few decades ahead at least. It has brought out the most beautiful things of humanity in terms of human compassion. When WHO talks of mental health, it says mental health is a state of well-being, and you are able to understand your weaknesses, you're understanding your strengths, and you're able to execute and live in a meaningful and successful way and contribute to the society. If going by that definition itself, we found that every individual in my country, that's Bharatavarsha, in India, have contributed in some way or other to a fellow human being, which hasn't happened in any other country. That is the kindness and compassion of a country. And ladies and gentlemen, you would find that I can touch, you randomly go across anybody, I'd say when you walk back, आपने pandemic में दिया कितना लिया कितना, हर कोई दिया ज़्यादा लिया कम. Even the person on the street who has been suffering has contributed. You find these beautiful stories of beggars contributing money to the cause of food to the people. This is a country of giving. And ladies and gentlemen, psychiatry gives you this huge scope, and not just about, giving in terms of monetary terms or giving your physical energy, but innovation. Your innovations, you always think that innovation is something about creating a product. Innovation has always been product centric. We want a product which could be monetized or develop an intellectual property which could be monetized. Innovation has always been that centric. But psychiatry, I'll tell you two things which we have done from our side in our organization. Pre-pandemic and post-pandemic, one thing we have done is that we have evolved an ecosystem of consultation for psychiatry, which is seamless, which we've been trying to do this, long distance consultation, what we now call it as teleconsultation, since 2011. And come 2019, 2020, and 2021, in these 2 years, we have developed a very beautiful ecosystem, which is seamless, which was so difficult purely because it could be because of technology, the bottlenecks of technology, could be because of bottlenecks of legality, as Dr. Harish was talking about earlier, and perhaps because of bottlenecks of morality and the bottlenecks of the whole medicine as it's been defined as practice. The whole idea of having a touch and feel medicine, which we have been trained as. Because unless I touch my patient's hand, I don't feel comfortable and don't feel I've done something. So the whole construct has changed. And so not just my practice, many other clinicians in other specialties have evolved, and commercial organizations which could do it seamlessly have invested monies into the thing, like, I'll not name organizations, but to provide a seamless, continuous process. And in the process, nations have evolved. NIMHANS has provided guidelines for telemedicine, which NIMHANS is the National Institute of Mental Health and Neurosciences. That was the first organization which has provided guidelines. So the statutory requirements, the state restrictions and holding of things will change. And that is a good space for innovation, because we always are concerned, like, agar A mai kara to state ka, will I fit into the statutory requirements? If I innovate, say, a long distance monitoring device from US, would I be able to monitor it in India? Would the Data Protection Act come in the way? Or would other ways of restriction, like would I have to locate my servers there, servers here? These sort of issues would have been there. Now there is lots of flexibility in terms of that. Two, we have in the process, in the last 4 years, we've been working on AI in mental health. We were thinking, could we have a machine do the diagnosis? Can somebody talk to a machine which does ask questions and the person answers, responds, and can it pick up both based on video data, audio data, and contextual data, and the language, sentiment, and all those engines put together? Can we actually come to a reasonable diagnosis, which should be on par with a human consultant or a human clinician or a physician? I presented a paper in IIPP Mumbai. This was about 2 years ago, before COVID. From there, today we are able to get to a point where we are confident that we could raise some IP, intellectual property, in terms of getting to a diagnostic category matching and an inference engine, as they call it in AI, an inference engine. That's where we are. So pandemic has contributed in a positive way, and this is one area which could be translated into dermatology. We all know that dermatology, melanoma is much more better diagnosed by AI than a clinician looking at it in a clinic. This could be translated to histopathology. This could be translated to watching MRI images, and then this is going to be a very different and a beautiful medicine. And this has been a catalyst. So instead of blaming the pandemic, we've done that. We've been there. I think we've suffered. I think it's time for us to get out of it. And we have done something interesting in the last 6 months. We used to have this medical record server system, psychiatry medical record server system based in our unit, and it was an expensive server to maintain. It really cost us tons of money, not just maintaining the server, keeping it alive, keeping it going. And last 2 months, we've moved to a Raspberry-based server. Raspberry is a tiny device, costs 7,000 rupees, PHIC, and our server costs 9,000 rupees, which is peanuts. And the cost of running the server, it doesn't cost even like 200 rupees a month in terms of electricity consumption. And the maintenance has been pretty low because it could be remotely maintained by somebody, a technician who doesn't have to visit the site on any basis. And I can carry my server in my pocket and go anywhere and plug it in, and my practice is still there. So this pandemic, ladies and gentlemen, has been a great boon for innovators. And now something more dramatic is happening. Earlier, we had this limitation of processing power. Psychiatry has been this thing about, it needs a human person to feel race, which is a Western-defined parameter. Like, ye karna hai, ye karna hai, ye karna hai, ye karna hai, itne paise banana hai, monetize your idea. I think we are people, if we have a great idea and you think it benefits humanity world, and this is going to be an India-centric model, we are going to redefine medical care in the future, and India will be a leader. We are closer to becoming Vishwaguru, and we are almost there. This little knock, and I urge you all to invest in mental health well-being, and we all will be doing that. Thank you very much. And just one little tip before I go. We always have this tadabbul, this craving, and because innovators are restless, innovators are sleepless, they don't want to sleep on an idea. Sometimes it's important to just relax, chill out, and watch the grass grow. When the grass grows, it doesn't make a lot of noise. We have a little paddy field. I grow a little small amount of paddy, in the half-acre wala paddy. And then we transplant, and then it grows. It never makes noise, and it feeds a lot of people. So sometimes sit back, grow like the paddy, little grass, and when the season is right, and this is the season is right, ladies and gentlemen, to innovate, invest yourself in psychiatry. We're not far from quantum computing. Let's all be part of this journey. And thank you very much indeed for patient listening. Thank you.
Dr. Praveen. With this, may I now invite on stage Dr. Rangareddy Buri, President IFCAI and convener of PHIC conference, to present a memento to Dr. Praveen Kumar, Chintapanti, consultant psychiatrist at... A huge round of applause, everyone.